Thank you, sir. First of all, thank you very much, sir, for giving me this opportunity. And I thank all the IMA Bhubaneswar members for giving me this opportunity and be here to listen to me. I don't normally talk about traditional medical subjects nowadays. So I am now thinking of how, like, it's my 35 years in this medical profession. So I thought in the 35 years I have passed through many ups and downs, like every one of us. But I've seen that almost everyone they don't discuss this thing. We discuss with patient, we discuss with patient relative, we discuss with our friends, discuss with. So we have a talk doctor to rest of the people, then doctor to doctor. You all agree, we never share our pain and agony very seriously with anyone. We can have we always talk, but not very seriously. Everybody wants that these are bad things. But I thought only talking that ki, this is not good, this is not bad, there is not bringing any solution. So can we bring some solution to that? And it needs time. And it is a need of the hour that we people who are now at the towards going towards like I'm 59. So I think I'm also thinking ki how rest of my life I will be utilize my knowledge, because skill is something we have given for so many years. We all have shared our skill, we have served with our skill, but the knowledge has gained by, I think, 100, 1000 folds in this last so many years. So I thought, can I share my knowledge? Can I share my knowledge? And I found where to share my knowledge. So I found that there is no platform. Everybody's got telling me to talk about a subject like gallbladder, spleen, appendix, where thousands of things are telling. And our students and everybody has got in this Google Edge, everybody has got a mobile phone and they are getting the information what we wanted to tell them. But the things which is inside our heart, it is never being shared. Nobody is asking us how much painful journey we had, how much difficulty we had to treat a patient, how much sacrifice we have done. Everything, everybody has sacrificed their family, their time, their money. Name a thing we have sacrificed, but we did not get any recognition. So I thought, why not to make a platform for that? If it is not there, why can't we build a platform? And since last 10 years, I've been trying to build this platform, and ultimately we made a platform called Global Self Health Care Education and Research. And now I'm coming to doctors also. And thank you, sir, for giving me that opportunity. And today this is the introductory class session, I can say, because it will go on continuing. And it is not me only in this platform. What we are going to do, that we are going to discuss today. And I want that everybody should participate in this program. So I name the program Dr. Biswajit Speaks. So it is not I will speak, but I will make you people also speak. Fine. So it is not typical lecture which I'm going to give you today. Here today we are going to this will be a platform where we'll go to have a reflections. We'll share our reflections. That is very important. This particular word, remember, reflections. What we think about the world, about the colleagues, about the hospitals, about the present medical system, about the things going on, about the future generation doctors. There's so many things we have to discuss because
ଆପଣ ଆପଣ ବୋଧେ ଦେଖିଥିବେ ମୁଁ ଆଜି ଗୋଟେ ଫ୍ଲାୟାରରେ ଗୋଟେ ୱାର୍ଡରେ ଲେଖିଛି ଆକାଶବାଣୀ ଆଜି ଆକାଶବାଣୀରେ ମନ୍ କି ବାତ ବାଇ ସତ୍ୟଜିତ
yes, sir, I saw that. Yes, yes. Today I am telling you Man Ki Baat, and because I know ki alone it is not possible. I need people like you. I need so many senior people. I need the people who can spare some time. I need people who have lot of things to say, lots and lots of millions of. If everybody will start telling a story, it will take every day, 365 days, and 10 years will go with everybody speaking one story. Fine. So it is a platform where we are going to speak, we're going to listen, we're going to reflect, we're going to agree, we're going to disagree also. We may be having a lot of points where we will be disagreeing also. It's good. Disagreeing and this conflict also is good. We will be doing in this platform, and we'll confess also. Let a lot of people, a lot of things, like I have a lot of things to confess. Like we have done mistakes because this is a platform for doctors. We have done mistakes. We have done former mistakes. There's nothing wrong in it. So, because the moment we confess our mistakes, our next generation, the people, the younger people, the younger generation who will be listening to this, they will be brave enough They will think a mistake is a sin. But in our profession, mistake is not a sin. Mistake is experience. We all have done. You agree on
Right.
the person who doesn't say, okay, I have not done a mistake. I don't think he has done a good medical practice. So we all have done mistakes. So if we share our mistakes also, then it is going to change. The future generation is going to listen. Yes, our senior have done the mistakes, so we have done mistakes, so we'll correct it. Because if you accept mistake, you will have a chance to correct it. I always say we do not know what we do not know. It is very dangerous. It is very dangerous. It is not dangerous that we do not know, but it is very dangerous that we do not know what we do not know. So here this platform will be speaking about what we do not know. We'll have to reflect. So this is where we are going to speak about the unspoken pain points. There are a lot of unspoken pain points we have never discussed with anybody, but we will be discussing here. Will we offer practical solution to the problems? We can discuss of the problem, and you can once we agree that this can be a solution, and we may forward it to people, forward it to our platform. Ki this is a solution. Everybody think can you use it? Can you try this? This is you can do, and we can we can start thinking beyond the prescription. Like this center where I'm sitting today, when you are this is my what do you say conference hall, and this is where this name is New Prescription Point. So here we change the perception of people with the prescription. They come with a prescription to me here. I look into that prescription, I go through them, and I try to talk to them about. So here they change the perception towards their own body and mind. And you will not believe, I'm getting lot young people, 35, 40, 25 years from school. Children are coming here, and when I talk to them, I find that there are a lot of what do you say scope, and they are so happy. Their parents are so happy because I'm giving them 1 hour time, and it's nothing is free. I'm not telling it's I'm doing a charity. I'm doing a thing which is a part of my curriculum. Is that doctors, as a doctor, I have a lot of knowledge about your body and mind, and we are the best counselors. I believe the doctors are the best counselors. So I'm using that particular thing which is there inside us, because I don't think anybody is a better counselor than a doctor, because we know about the body, we know about the mind, we know about the physiology, we know about the biochemistry, we know about the disease, and we have a solution to everything. Only thing is that we have to give time, and that is a scarcity. I think we all can give time, and it is not free. We can earn 3 times. I always say you can earn 3 to 4 times. I charge 3 times sitting here for 1 hour. No, people give me. They give me a lot of. They give me money with the respect also. The things that you have to take. We are charging very little, because now they're very happy. So here we are going to discuss that. And I always say there is a word I last time also I uttered, that we are serving with our skill in the hospitals and the clinics, but we should earn from our knowledge. This is a tagline. We should earn from our knowledge. And when we start earning from our knowledge, I think that day is the best day for us, because we'll be doing it very happily, and there is no tension in sharing a knowledge, because the moment we share our knowledge goes on increasing. Like I'm sharing with you something today, and I'm increasing my speaking ability, my stage presentation, my everything. I'm improving. At the end of the show, I'll be more improved than before. That is what my aim is. And and here we have to say that there is one line I will say, that is called patient centric and doctor friendly atmosphere. I mean, doctor friendly atmosphere is very less nowadays. Even in the hospitals, if you see in the hospitals, it is not doctor friendly. Even our colleagues are not behaving with us properly. They are hiding from us, or they feel that we are their competitors. So a doctor-friendly atmosphere is very much needed. And what this Akashbani, Bhubaneswar Akashbani is doing, I think it is a step Sir has already taken. I want to now give it a wing, so that we can fly more. We can fly more. We can bring such a beautiful community, which we are already beautiful. We are very good people. Doctors are the best people, I always say. And I don't think we have any competitors. I have not yet found any competitor with me, though there are 28 surgeons in the city. I have never I think anybody had competed with me ever. Even I teach school children, that is called Race Against. I have written a book also, it's coming up very fast. It is called Race Against Yourself. I compete with myself every day. Every day I compete with myself. I feel that the more I compete with myself, the more better I will become. But the moment I compete with my colleagues, The moment I compete with my other doctors, then I will be going down and down, and it's happening. The more stress and everything is coming from there only. And I think, and I have a very important thing to say share today, which I have delivered to my postgraduate students also. They how our future doctors should be. How should we be? So I have three eyes for my future doctors. I call them the future doctors should be inspirers. They should be inspired. They should inspire the patient. They should inspire their colleagues. They should inspire the public also. They should be innovators. Innovators means we should, because we are innovators. We are innovators because we work in the most adverse condition by innovating ways. We don't practice. Every doctor, every surgeon, they have practiced in a condition which is not written in our books. We are already innovators, but we have to express ourselves as innovators. We should be integrators. The three I's. We should be inspirers, we should be integrators, and innovators, and last one is integrators. We have to integrate so many things, because when you are talking about disease, we are treating as about textbooks, as about protocol we are teaching. But with that, we integrate the health, because we are not integrating health there. All of our attention goes to treating the disease. And after the patient, we treat the disease, patient goes home, he forget us, or he comes when again he has a disease. So I have made it a point that I will integrate all the health, because it took me a long time to learn about health. In 2011, when I had a problem, when I was looking that I should be out of the drug, and I was thinking what to do. So I took help of so many people, but I found that the health segment is totally unexplored by doctors, and it has been taken care of by people who are not at all health literate, and it is misinformation is very high, and they are fragmented. So in last 10 years, what I did, I started doing a integration of knowledge. So once we integrate those knowledge, health knowledge with our disease, I think we are the complete doctors. We are going to be complete doctor, and we will be doing the best for the person, and also we'll do justice to ourselves. That is what. So I want to share my screen now. Remember one thing, healthcare industry, jo, what we call this now to the healthcare industry, it is no more a doctor's domain now. It has gone out of our hand, unfortunately, because we never took any action to stop it. It has gone because we are now 10%, not 10%, less than 10% of the healthcare industry. It is very painful to know that we are the front men, the soap men of the industry, but the control is not with us. We are, because in the hospital, if there are 100 employees, 10 people are doctors and 90 are non-medicals. So that's why the ratio is changing. So somewhere, can we do something? Can we take some action in future slowly, so that again this profession will come back to us? That's my question. This is a pain point. I feel very pain. It's painful that when somebody talk to me about instructing me to treat a patient with the things they want to do, it's very painful. I have never seen, because 20, 10, 12 years back it was not there. I think when you people are doing, that was not there. But in last 10 to 15 years, everything has changed. And we are now reduced to 10%. So here, can we do something to redefine the healthcare industry? So how can you do it? So it's a question we'll be discussing with that again and again in this platform. So now question is why this type of things now I am coming up? It is not now. I've been thinking since last so many years, but I never had a platform. So after I made the platform, since last 3 years, I've been researching on all the things, all the avenue. I've been meeting people. I've been doing my homework. How can we redefine? So I realized one thing, that now the healthcare industry is very stubborn. It is growing. It has grown to its height. It has gone to its height so high that it will not bend to anybody, not to even doctors. They can use us, but they will never bend. Now, when we can take care of the health, our knowledge, if we use, and we can build a health industries which simultaneously, if we take control of the health industry, which is more powerful and more bigger than the healthcare industry, then there will be a parallel. When the people start asking for the health doctor, they will come to us for health, and we will be the person sharing our knowledge. We do not have control of anybody. That is maybe a time when will come when we will again be equal to the disease care industry. So that is where we have to take part in this part, because we have neglected this part, because we are so busy in treating diseases, we have neglected the health part. So I have created step by step formulas and everything, gathered, integrated the knowledge from starting with physiology, biochemistry, and you talk of anatomy to public speaking to everything, and to digital, even digital marketing is a part of healthcare industry now. So all these things I have created. So doctors are, I would say, we are clinical clinicians. We are emotional, legal, social, and economic burdens that rarely get a safe platform. There is no platform. IMA is a platform. We are talking about a disease doctors platform, but we never discuss all the things which I'm talking about. We never discuss about emotional burden which you have. We never discuss about social thing. We never discuss our economic burden. We never discuss all these things in IMA platform. So I was looking for a platform. So I have created a platform where you can discuss everything you want to discuss. Fine. So it is a
Let
to
me
save.
interfere. Let me interfere for 2 minutes. I remember in 2004 when I have taken up this IMA activities, being an active member in 2004, uh, while preparing for a magazine, late Dr. Paricha, who was a very good social activist doctor, and he was our past, actually, student leader in 1960s in our medical college. We had gathered few informations that who controls us. There is always a pressure from the legends of our medical oath, from the oath. Number one. Number two, gradually it is being changed from oath to legality to threatenings to gods, computers, so many things are on the head. And then how we can think of
Yes, we can, sir.
developing something?
We can think, sir. This is why, that's why I'm slow. That's why I'm coming now, because we have, I have started built up a system. Because without system, nothing will work. Without system, and nothing will work, because we are having this burden. So we have to discuss out initially within us, then we can strengthen the system. So we'll discuss. I will come to that in this every Thursday. We'll discuss something like that. So we doctors listen to patient every day, but who listens to doctors? It's a very you can ask us who listen to us. Nobody, neither the hospital, neither outside, nobody listened to us. So our expectations have changed faster than professional support. Fine. Medicine is increasingly defensive, transactional, and emotionally costly. The people say young doctors need direction. There is no one to give direction to the young doctors. And I think this is the role which you have to play. The senior doctors, they carry the unspoken wisdom. We have the wisdom, but we are not speaking up. The wisdom which we have, we are not speaking of. Why can't we? Who stopped us? Because we are busy? That is one thing. We all are busy. But we have a responsibility to the next generation. So here it comes to the importance of this type of programs. A collective voice can transform fear into clarity and silence into leadership. So we need more health leaders. We don't need management people. We need leaders among us who will lead a group of people who are millions of doctors to one stage, not these media political leaders. We need people. So we have to build up somewhere. We have to prepare ourselves as leader. And leadership is a quality, it is a learnable thing. It is not that it is not learnable. Not that Modi ji has become a leader in one day. He has learned step by step everything. He has applied the process. So I have now when I go and speak about leadership in the corporate world, I have a program called Cellular Leadership Protocol. So everything has got a cellular success protocol I made for the people who are competitive exams for UPSC. Because cellular is a protocol, it's a technique, it's a tantra, nothing more than that. And when you have a protocol, you will be successful. The chances is very high. So we will be doing it gradually. We'll know, and I will come to that later on. So what these programs on every Thursday we'll be doing, it is a dignified platform for professional reflection and collective problem solving. So we'll be discussing
So,
on this only.
Neeraj, what is
And so here we'll speak about or let doctors express what is usually hidden behind duty, discipline, and silence. These are the three things which make us silent. You know, duty, you would know about the oath which you have taken, and another that called we call it I call it tunnel vision which is given to us that doctors will do this only. No, doctors can do so many things. Why only present treatment? We can be good leaders, we can be good speakers, we can be good, and we can do anything because we are the best. So here comes the discipline. We have to, behind duty, discipline, silence, we have to speak up. We don't speak. Nobody, we always open our mouth very slowly. Fine, we don't never, because if you see every profession they shout, but we never shout. We just, because we have a responsibility. So we have to speak. We have to reflect, examine everyday's professional pressure without blaming patients, hospitals, or system. So what I'm doing today is I'm not blaming any system. It will be there. We cannot change them. So what can we do? We can bring the change from ourselves. We can bring the change within because that is possible. What can I do? How can I serve the community more and more? That is inside me. But I cannot say to change the hospital. I cannot say my hospital to change their behavior. I cannot ask a corporate if they will not put the target. I can say, but I can always refuse. No, I cannot fulfill your target. I am a doctor. I will do the things. But that needs a courage. Fine. And restore the professional confidence, self-care, communication, and emotional balance. We have to heal ourselves. We are all sick people. In the morning, if you go to the hospital and when you come out from the hospital, you are so much a burden, patient burden, hospital burden, the relatives burden, and the everything financial burden. In all the burdens, we are so unstable people. And we really, I worked for a hospital for 22 years. And 22 years, I built up the surgical department fully from one patient to 100 bedded hospital full. And you know what happened? When the management changed, the son came, we had to leave the hospital because we couldn't tolerate that one. And one fine morning, I found the things which I built. So it was an emotional trauma to me. And maybe that was these are the things which has brought me to. It's not that I'm incompetent because I was emotionally unstable. That for some was I think for 15 days or 20 days, I was thinking why this thing has happened to me. I built everything, and now everybody must have faced this. So now it comes. So we have to heal ourselves also somewhere. So we have to take self-care. Our confidence level, though it is skill in a skill field, our confidence is very high. But when it comes to the other part, we are not that confident. And we have to move doctors from passive survival to ethical influence, and we have to be leaders. So somewhere we all have to build that leadership quality and it has to be learned. We cannot be leader just like this. Every person has to be a leader. He has to follow certain protocols and he or she can be a leader. This is not a complaint platform, a thinking platform. Not against anyone, but I always say that it is for the clarity and dignity of the future of the profession. So we will be discussing in this platform all these small things. So there are, as I told you, we'll be discussing about the pain points. There are certain pain points for doctors, and we'll highlight these pain points. This show will take up one real issue at a time and move towards practical solution. Suppose we'll one day we'll talk about burnout and emotional fatigue, our exhaustion, irritability, family sacrifices, loss of joy, and we'll all discuss out how it is possible that our next our colleagues what message we are going to send to the things. And this is second one is we call it medical legal fear, documentation, consent, complication, defensive practice. We all are busy with that. How to overcome that? How can we? Because these are all mechanical things, and it needs less time. And then we have to think at the first thing. I call it first thing first. So if we understand which work to be done in the first and which should be done last, we can teach this our next generation. And these things will be very small. They are not very big things, but these are very important things. Trust deficit, Google information, social media, narratives, violence, risk, all these are coming because of the trust deficit. Somewhere we have to talk about one day about the trust deficit, why it is happening, where we should work, this communication burden. How can we become our communication I have found one thing that most of the problem happens because of the communication gap. and nobody is teaching our doctors. Doctors are very poor communicators. We that is one thing, because communication is a skill. When I started learning it, I have to learn communication skill step by step, because it is a skill. Communication is not what we speak. People think that when I ask people, what is a communication and how much our words and our that matters, then 90% of people they answer me that words consist of 90% of the communication. But unfortunately, the truth is that word consists only 7% of the communication skill. Our body language, our tonality, they makes a lot of difference, which is not there with the we're not teaching and have been not taught in our medical curriculum at all. So I take communication skill classes to our postgraduates. This is very important. It takes me 2 hours to teach them communication skill. So it is very important. Ethical pressure, corporate targets, affordability, package, culture, conscience, all these things has to be discussed. And in this platform only, in doctors forum only, not in a forum where the people are coming, management people will come and talk about this ethical things. And I talk about the young doctors which are very insecure. They feel very insecure nowadays. I see them. They get a good package, but they are very insecure. They go on changing hospitals from day to day. Today here, to tomorrow there, because of so there's something we have to think of. Ki how way to guide these young doctors. Can this be a platform for these next generation doctors? That is important. So how we are going to spend this 30 minutes? I have just decided this will be like this. First 2 to 3 minutes we'll start opening the program. Then pain point we'll discuss one pain point. Then story or confession. Anybody has to tell about that particular thing we'll talk about. Then we'll analyze. Then the solution framework. Then our voice. What should be our voice? Then we make a conclusion. This is where each episode will end with one practical takeaway and one question for doctors to respond. Just like what is one thing you wish to with the patient understand, it will take to understand doctors. So this is where we can one by one. It may take a lot of long time, but I think we have no other way to than to patiently wait and start doing something. At least a small progress can make us big one day. And the format is like this. The format can be anything. It can be an interview, like share journey, experiences, and professional insight. And there may be anonymous confession. Like we have a lot of things to confess. I told you. Speak safely about difficult emotions and dilemma. Unspoken words, which we have never told to anybody. We can talk in this platform. Group discussion we can do with 2 or 3 five panels. Young doctors' voice. We can listen to interns, resident, DNB people, early career doctors. We can ask one them to talk about that problem and can we give them a solution. That also we can do in this platform. Senior reflection. All the people who are senior people sitting out here can mentor. I always say we are always being a consultant. We have become good teachers, but we have never become mentors, because there is a difference between a mentor and a teacher. Mentor is always stands with the person till the person reaches his goal. But teachers, we come and teach. Like as a teacher, we come and teach the thing and go. We do not know. But mentoring is very problem. So I have used a word in my some of my articles we call is in time is to create doc mentors, doctor mentors. We have to create doc mentors, not one, two, three. We have to create hundreds of mentors who will be holding hand of one and take them to their what is it destination. Then problem solution clinic. We have to have like what I do in my new prescription point. We discuss about the problem and give a solution. One practical problem, one success solution. We can always and and we can always you can always suggest topics. Doctors may participate once occasionally, but I always say we say or a regular they can be a regular contributor also. This is possible. Fine. So the topic, like these are topics which I have decided a practical editorial map for this. This is which I've thought of. These are the things which I would anybody can talk and take anything from this. Like professional reality, doctor-patient trust, violence and mistrust, corporate pressure, ethical dilemma, inner life of doctors, burnout, guilt on after complications, family sacrifices, self-care, where we failed. Like when I talk about where I failed about my self-care, people cry. when I in my seminars, first I talk about why I am into this, because the day I had a problem, I was thinking, why me? Why me? Why I had a problem? And I found I am the responsible person for this. So I didn't take say my own care. Today I take my care and I'm off the drugs and I'm very happy. I don't practice after 5 o'clock. I don't practice after 5 o'clock because I know this time is mine. Nobody can take my time to anybody. Future practices like young doctors, financial dignity, second income through knowledge, doctors beyond prescription, all these things we can discuss around in this. Anybody can take a topic. And then healthcare reform. How can we do the disease care to healthcare? How can we do it transform? How can we make our journey from disease care to healthcare, the real healthcare? It took me last so many years to come to healthcare, but now it is all so structured. Anybody come to this with the cellular protocol. Everything is written now in books, big book format. So prevention part, self-health care, I can say education. These are all very important. So cellular philosophy is going to help our next generation doctor, no doubt about it. But everybody has to go through this protocol once. This I always say. So these few episodes from for 12 episodes I have done why doctors are silent. We can have discussion. Doctors also are human. Then we have the trust. What changed? This will be doing an episode. I'll send you this thing to all of you so that anybody who wants to participate, they can also come and on this particular day we can discuss, and so that we will be free to ourselves. We will come closer to each other, and we can build a community among doctors who will be thinking beyond prescription. Here we are not discussing about, because every time you doctors meet is there is a CME. I don't understand. Nobody goes there to listen to CME. Everybody goes there to take a dinner. But we name it CME, and the speaker will come and bore the people for 1 hour, 2 hour. Hospital come with 5 speakers. Fine. And you have gone there. You don't even get a time to talk to your colleague also. But this platform will be not like this. Here we will be discussing and with among ourselves only. So we can talk about communication as clinical skill, burnout, nobody talks about, ethics in corporate healthcare, what doctors make, when doctors make mistake, what happened to us. When I did my first complication, I remember what was my condition. And I talked to my residents about this when they do complication. And suddenly they get relieved. This is what is the need of the time. Fine. And the most important is financial independence doctors. If I am sitting here today, and I know every doctor is financially independent and financially in the bank, but mentally they are not financially independent. Because everybody thinks that if I stop practicing, then I'm so younger to almost all of you. But I know I don't have much money, but I have invested a lot of money in this type of things. I spend a lot of money. But I know I'm financially independent, that at the end of the month, if I don't do anything also, I'll get X amount of money, which will lend me. I'm not I think we all have everything for our need. But I know there is not enough for our greed. That is the thing we have to differentiate between this thing, and everybody sitting out here must be financially free. But now the rest of times we engage ourselves because we have to engage ourselves in the hospital, because we think we have no only one thing, that is patient care. But we have lot of things to share to the world. So here comes this program. I don't know how much changes it can bring, but I think this is an initiation. I have started it. I know it is possible. When I know, and there is a for you people, I tell you, I'm an NLP trained certified trainer. NLP means neuro linguistic programming. I'm a certified trainer for that. And when there is a one saying that if one person can do it, anybody can do it. There is the best example is that everybody know about this Roger. Roger Bannister in 1958. In 1958, the Olympic, I'm talking about the story about that, Roger Bannister. In 1958, the Olympic, before that, everybody was thinking that 4 minutes a mile is impossible. The physiologist used to tell that if you cross 4 minutes before 4 minutes, then your heart rate will be so much that you will die. But Roger Bannister, for the first time, he completed the race, this 4 minutes mile, and it came out 3 minutes something. And for the first time in the history in 1958, so that record was broken. That is not big thing. But within next 6 months, there were another 22 people who did less than Roger Bannister. They crossed the limit. So what happened? It was not true because it was in the mind. So ethically, if one person can do, anybody can do it. So if I think today I'm sitting and I think I can discuss, I can think of doing something, bring changes. It is not that key. It is not. It will not be possible. But it needs people. It needs all of your cooperation and your help and time also. This is so, why doctors should participate? Because we have to guide our young doctors. We have to represent real practice, bring on ground level realities into public professional dialogue, rebuild the trust, and shape reforms. Shaping of the reform is very essential because your voice can protect, guide, and redefine the future healthcare. So you are so important person, all of you are so important, and you have the whole of the responsibility of changing a bringing a new scenario to the world, to bring a new reform. And why can't we do it? Let us join hand and do it and create a new platform where we will be able to share and do the things for the next generation, for people, for public, for everyone, and especially for us. I think thank you very much. This is what I wanted to say today. Nothing more. So choose your role as a interviewer, panel discussion, anonymous contributor, young doctor's voice, senior doctors, and as a mentor, and all the topics we can say. And I am Akashbani Bhubaneswar will do the coordination part. I think we all can do this. So I call it a call to doctors and register, participate, and redefine the healthcare. Your experience matters, your struggle matters, your silence
It,
matters. Your voice can guide another doctor. Remember, we all should be guide to each other. Thank you very much for listening to me.
thank you, Biswajit sir, for your suggestion to this profession. Uh, can I just suggest one thing? The basic thing that can change the health education, our medical education, which is the primary education and builds the main platform for all this, which we were having, and presently it is lacking. And this should also be included as one of the
Yes, sir.
points in
Certainly.
your discussion.
This is a part of
Sir.
already. It is part of this. We can discuss these young doctors means
Right.
we have to talk about their. Because recently, I wrote a lady, a girl from Pakistan, wrote an article in my newsletter in Art of Self Healthcare in LinkedIn. She wrote it so nicely. I thought, I will publish it for my newsletter. So she wrote. Everyone can go through the LinkedIn article. I will send you, share it with you. That girl has really written what the present medical is going on and what they want. She's a first year MBBS student. She's a first year MBBS student and she wrote ki what I want from medical profession. And I had shared and it is seen by more than 7,000 people in LinkedIn. And there are a lot of comments and people are thinking everywhere, people are thinking of redefining the healthcare. But thing is, who will bail the cat? Maybe one day we will.